Hi, I'm Ryan Green. I'm a physical therapist with Yada Yada. Today I want to talk to you about total knee replacements and why it may be a great option for when your knees just wore out. Now, having a healthy knee joint is vital for normal everyday life, to enjoy your life, to do your hobbies, to work. And without it, life can be very depressing. It can be hard. So total knee replacements become very popular throughout the last few years. And in fact, in the United States alone, last year there's over 790,000 total knee procedures performed. And in medicine, it's one of the most successful procedures that can be done. So it has a good track record. Now, to understand total knee replacements, we need to understand human anatomy, the knee joint. The knee joint is one of the biggest joints in the body. And to understand more about knee replacements, we need to understand the joint. So if we look here, we have the femur bone, we have the shin bone, which is the tibia, we have the kneecap that grows inside the tendon. And if we flip this off, you have ligaments on the side. The ligaments tie bone to bone. They provide support and stability. And not shown here, you have muscles. The muscles provide the movement and strength. And at the end of each long bone and in the joints of the body, we have what we call articular cartilage. Now, articular cartilage is amazing. It is 15 times slicker than ice on ice. It's like taking an ice cube and sliding it across the ice skating rink, but yet it can withstand hundreds of pounds of pressure. It's amazing. Now, through injuries, aging process, even being overweight for periods of time, we can slowly wear down that cartilage. We will start noticing pain and inflammation, swelling around the knee joint, and everyday life starts to become hard. When that happens, it's a good time to go see an orthopedic specialist. He can take x-rays and he can tell you what the knee looks like and tell you what condition the cartilage is in. If that cartilage is wore down, pretty soon it becomes bone rubbing on bone, and then you'd have a lot more inflammation and pain. Once the cartilage is gone, it's gone, and that's what we call arthritis. So at that point, you probably would be a good candidate for a knee replacement. Now, a lot of people ask me, what does the doctor do when he goes in and does the surgery? Well, I'm going to tell you. Now, whether you have it done at a surgery center or at the hospital, the doctor will use navigation system or robot-assisted technology, basically using a CAT scan to take several images of the knee. He'll create a 3D picture and broadcast it right up on a screen that he can see. And from this, they can create an individualized treatment program based off your anatomy. So the technology allows him to be more precise and sacrifice less tissue, and it's just a much better, cleaner procedure now. So when they do the knee surgery, I'll use another model here. The doctor will use this navigation system to make the exact cuts. He'll take the end of the femur and he will shape it to place the metal cap, basically a titanium, cobalt, chromium mixture metal cap. And then he'll take the tibia bone, the shin, and cut off the top portion, remove the diseased bone, the arthritis and meniscus, these pads, he'll remove it all. And he'll put a plastic component on there. If you see closely, there's a metal stem that goes right down through the tibia. So sometimes they cement that in, sometimes they don't. You'll still have the ligaments on the side to provide support and stability. And on the kneecap, they'll create an incision from about here, 2 inches above the kneecap and below approximately. That way they can take the kneecap, the tendon, flip it over, and cut the diseased portion of the arthritis off the kneecap and place a metal component there. So when it's all said and done, you got plastic rubbing on metal, no more arthritis. It's great. Now, after the surgery, you'll probably be seen by a physical therapist the same day. He'll get you up with a walker that first time, have you walk a little bit, get you comfortable, and then he will teach you some range of motion exercises, some nice easy strengthening, and then you'll more likely stay the night. Now, some people do go home the same day if it's done in a surgery center and they're doing well, but if you stay in the hospital, you could probably still go home that same night, or you may stay another day and do physical therapy the next morning, do some stair training, make sure you're safe to go home. Now, when you leave the hospital, you have 3 options for physical therapy. The first one is doing home health, nursing, and physical therapy. Most people do choose this option. This is where the nurse will come in, she'll check your vital signs, check the incision, make sure it looks good, and make sure you're doing good on the medications. Then shortly thereafter, a physical therapist will come in, probably a day or two. He'll resume with the same strengthening, stretching exercises, and slowly get you back to normal activities. This will last about 2 weeks. Now, that's a great option. Another option would be some patients just want to get right into an outpatient therapy clinic. 2 days after surgery, they'll come in and just start the therapy there. The third option is for people that may live alone, who are struggling a little bit, don't have the greatest balance, and just don't feel ready to be able to handle everything at home. They may need a little extra help. So rehabilitation centers are a great option. They go there for 3 or 4 days, maybe up to 2 weeks worth, to work on strengthening, to the ability to do stairs, better balance, and just get safe enough to get home. Now, if you don't know what option you want to do, that's okay. You just go to the hospital, you have a case manager, a physical therapist, and doctor that can help you come up with a good game plan based off how you're doing at that time. Sometimes it's hard to predict how you're going to do. Now, either way, after the surgery, around that 2-week point, you'll see the doctor in his office. He'll come in, he'll take the staples out, he'll check the motion of the knee, review medications, and then he'll prescribe outpatient physical therapy at that time if you haven't already been there. Now, when you go to outpatient physical therapy, you'll go about 2 to 3 times a week for about 6 to 8 weeks. And the main goal is to get your range of motion in that knee back. The knee has to bend about 125 degrees and it has to go all the way straight. So a lot of people haven't been there in years. That's why it takes so long. You got to do a lot of stretching and strengthening, working on your balance, agility, things to get you back to work, back to hobbies, and back to your life. When you're done with the formal physical therapy, we highly recommend you continue physical therapy at home. The therapist could come up with a good routine at home that you just follow. And research has shown it takes about a year to get your full strength back. And that's if you're working out about 3 or 4 times a week and doing some stretching. Now, I hope this video was educational, answered some questions, informed you on expectations, a little bit about the surgical procedure, and I hope you enjoyed it. Thank you.